My name is Letitia Grimmett, and this is my husband, Derek, and I've had the gastric bypass surgery.
My name is Debbie Millay, and I had the sleeve gastrectomy surgery.
My name's Charles Fox. I go by Bill. I had my surgery on April 13th, 2009.
My name is Tina. I had a gastric bypass done a little over a year ago.
Well, I'm Matt Walker, and this is my wife Shauna, and I had the gastric bypass surgery.
I'm Rick Flees. I'm 52. I weighed close to 300 pounds.
My name is Shelley. I had the lap band surgery, and I had it 6.5 years ago. And I'll be honest, if I had to do it again tomorrow, I wouldn't hesitate. It's one of the best things I ever did.
Probably one of the best decisions I've ever made.
It has changed the quality of life that I live now. It's totally amazing.
A life change, total life change.
I wake up every day, and on my ride to work, honest to God knows, I say every day, thank you, this was so worth it.
It didn't save my life, it gave me my life back.
Welcome to the bariatric practice of Dr. Cottom and Dr. Richards. This introductory video will give you more information about the options available to those considering weight loss surgery. Over the course of this 30-minute video, we will provide you with a brief overview of the types of surgery we perform, the risk of those surgeries, recovery times, and how much weight you can expect to lose. We'll also discuss the personal commitments involved, including which foods to eat and which foods to avoid, exercise, insurance, and how our uniquely designed staff can increase your chances for success. Through testimonials, we'll follow the stories of patients who've undergone surgery and improved their lives. We're confident that at the conclusion of these videos, you'll be more informed and better prepared to make decisions concerning your own personal weight loss goals. The goals for this seminar are to understand the multiple risks of continued obesity, the different types of surgical options, the risks and benefits associated with each surgery, how to proceed with surgery from today, and why the Surgical Weight Loss Center of Utah is your best option. Let's get started.
Perhaps the most amazing thing about bariatric surgery is the procedures that we perform last anywhere from 20 minutes to an hour, yet the effects of that procedure can be felt for a lifetime. Ever since I was a little kid, I wanted to be a surgeon. I was born in Salt Lake City, Utah, and at 6 years old I moved to Houston, Texas. I grew up in Houston, Texas from 6 to 23. I graduated from high school there and went to college there. I was married to my sweetheart in college, Amy Hardcastle. We finished up at Brigham Young University, and then we went to medical school in San Antonio. San Antonio was my first choice in medical schools. It was in San Antonio that we had my first two kids, Austin and Samuel, who were both named after Texas Revolutionary War heroes. After San Antonio, we moved to Long Island, New York, where I did my residency for 4 years. Then I discovered in my residency bariatric surgery with a surgeon by the name of Dr. Angus. And Dr. Angus showed me how happy the patients were and how dynamic the field was and how we're helping these people's lives. I said, that's what I want to do with my life. I then did a fellowship in only bariatric surgery for 2 years at the University of Pittsburgh with Dr. Philip Schauer.
He really has been on the forefront of bariatrics. He trained at probably one of the best centers in the country.
We then moved around the country and we adopted a little girl, Naomi. She was from the Atlanta, Georgia area. And now in Salt Lake, we adopted another girl. When my family gets together, we like to spend time up at our favorite ski resort, Brighton. When I'm not a doctor, what am I doing? I am usually mountain biking, skiing, kayaking, rafting, or just generally being outdoors. If I had to say what a good day for a bariatric surgeon would be, it would be the opportunity to perform surgery on people and change their lives in the morning, and then see follow-up on different patients in the afternoon, both short-term follow-ups, and most importantly, the best thing is seeing people who are 1, 2, 3, and 4 years out from surgery who've really changed their lives and taken control. And that for me is probably the most exciting thing, seeing how a 45-minute procedure can change a person forever.
Well, after I decided that being an astronaut and a supermodel probably were not in my cards, I probably really have been interested in being a doctor for as long as I can remember. I'm Dr. Christina Richards at the Surgical Weight Loss Center of Utah. I've been a bariatric surgeon for about 8 years now, and am really excited to make such huge life changes for patients, getting rid of medical comorbidities and giving them a life they never thought they were going to be able to have again. So I started out actually as an exercise physiologist at Ohio State University, and then got kind of bored doing that and said, well, I think I want to go to medical school, so went to medical school at Ohio State. Then I did my general surgery residency at the Medical College of Wisconsin in Milwaukee. Kind of got interested in doing laparoscopy there and was actually awarded as a chief resident laparoendoscopic surgeon of the year or something like that. And so decided to go on and do advanced training in laparoscopy. Went on to do a laparoscopic fellowship at the University of Washington, and then came back to Utah, which is where I grew up, to practice. I then actually adopted 2 children as a single person, thinking I would probably never get married, and then a wonderful man came along and we got married last summer. So now I've got my little family, kind of backwards, but I figured it out somehow. When I started in practice, bariatric surgery was probably the last thing that I wanted to do. I had seen some really serious complications in my residency, and I had felt like the patients didn't get a lot of support that they probably needed. I then had a patient who came to me and convinced me that I should start doing lap bands, and she wanted me to do it for her.
She's a very caring, loving, professional doctor who wants to be successful by having you be successful. There's no better definition of an excellent surgeon than that.
I then learned how to do that and said if I was going to do that, I was going to set up a program involving the hospital and a complete multidisciplinary program. And then it's evolved since then. I mean, decided we wanted to start doing gastric bypasses and ultimately sleeves. Dr. Cottom came and brought in a lot of expertise from his side, and it's really just kind of grown from there.
I've been in practice with Dr. Richards ever since I've come to Salt Lake City. We perform bariatric surgery together, and I can tell you that I've had partners as I've moved around the country, and she's the best partner I've ever had. She is very empathetic with her patients, strives to attain the best, and is generally an all-around good person.
It is such a gratifying feeling. There is very little in medicine where you can actually reverse diseases and have them go away. That's part of what attracted me to surgery in the first place, and bariatrics is even an extreme of that. It is just amazing to see people get in completely new lives, have 20 years extra to live, and to really live it to its fullest. It's been tremendous.
I was taking 7 medications prior to my surgery. I take 1 now.
Since the 1980s, obesity has been increasing throughout this country from, in a lot of states, less than 10% to over 30% in some states at this time.
Right here in Utah, 50% of all the deaths in obese women from cancer come from being obese, and 30% of all the deaths from cancer in obese men come from being obese.
Obesity is catching up to tobacco as the leading cause of death in America. If this trend continues, it will soon overtake tobacco. Centers for Disease Control and Prevention.
When we talk about obesity, we talk a lot about comorbidities. And comorbidities are medical problems that are caused by or made worse by being overweight. So there are things like diabetes, high blood pressure, sleep apnea,
hypertension, cancer, stroke, swelling of the feet and ankles, infertility.
They see their doctors more often, they take more sick leave, they have more time off work or being suboptimal at work because of joint issues or sicknesses. But we know that the vast majority of patients who have those comorbidities, those can be eliminated by weight loss from surgery. The National Institutes of Health actually does classify obesity as a disease.
Severe obesity is a chronic condition that is difficult to treat through diet and exercise alone. Gastrointestinal surgery is the best option for people who are severely obese. National Institute of Health.
They also say that, being able to lose weight and keep it off, only about 1% or fewer than 1% are able to do that. I would say it's rare enough that you get to be on the cover of People magazine if it happens. The reality is that it doesn't happen very well with diet and exercise.
The chance of losing weight through diet and exercise alone is only 1 in 1,000, while the chance of losing weight with surgery is approximately 80%.
Obesity problems in the United States. Obesity is one of the leading causes of preventable death. Obesity contributes to 50% of cancer deaths in obese females and 30% of cancer deaths in obese males. Obesity is the primary contributor to type 2 diabetes, sleep apnea, cardiovascular disease, and hypertension. And it is estimated that obesity causes 300,000 deaths annually.
Patients who are overweight find that they suffer discrimination at work. They a lot of times can't get advancement. They are often ignored by other people who just don't even look at them when they walk by on the street. They have a hard time finding seating in theaters, restaurants, in airplanes.
Obesity affects the ability of people to feel human. They can't get in and out of a car. They can't play with their kids. They can't go to the show. They can't get on an airplane. It limits their ability to enjoy the freedoms that thin people enjoy.
Social and physical drawbacks include various discriminations, limited physical mobility, seating issues, and clothing limitations. Now, how is obesity determined and when should a person consider surgery? We start with a BMI, or body mass index. It measures body fat based on height and weight. For example, this graph shows a woman that is 5 feet 4 inches tall, weighing 255 pounds. Her BMI is 43.8. To check your BMI, visit thinbeginnings.com and click on the BMI calculator. We consider surgery when a patient has a BMI over 40 or over 35 with medical problems, when a patient has been unsuccessful with previous weight loss attempts, when a patient is committed to a lifestyle change and agrees to a lifetime of medical follow-ups. Also, some patients with BMIs lower than 35 can be considered for surgery. A consultation with a surgeon would be necessary to make that decision.
My name's Charles Fox. I go by Bill.
My name is Tina.
My name is Letitia Grimmett, and this is my husband, Derek.
Well, I've lost 143 pounds in 5.5 months, and I've lost 10 inches around my waist. I was wearing 44-inch pants. Today I'm wearing 34s. The last time I wore 34s, I think I was 20 years old. I'm now 50, so yeah, it's totally awesome. So
I weighed 464 pounds. Today I weigh 254 pounds. I've lost exactly 210 pounds. And I chase my year-old grandson around the yard like it's nothing.
Officially, my weight, that when I stood on the scale and just kind of came to grips, was 286 pounds.
I was taking, I think we were talking earlier, 6 or 7 different medications before my surgery. One of them, I was a needle diabetic.
I had acid reflux, really bad. Attacked me almost nightly. Couldn't do anything with it.
My health conditions got worse. Doctors were flagging me. It was like bells were going off when I come in for my appointments. Ding, ding, ding. Oh yeah, you're the one with the A1C above 12. And my blood pressure got heavier and the medications kept getting switched and nothing was helping me.
After the surgery, I have not had heartburn, let alone acid reflux. It's gone. Totally eliminated.
The fact that I've never had to touch a needle since the day of my surgery is just awesome.
1 week after the surgery, she didn't have to take any of her medication.
Yeah.
She didn't have to take her diabetes, her
High
insulin.
blood, no.
She didn't take her high blood pressure pill. She didn't have to take many of about 6 different pills you had.
I did. Then
I can't even name half of them.
I was taking 7 medications prior to my surgery. I take 1 now.
one of the most amazing things medically about the surgery, and nobody can understand it, is when you have those health problems, the miracle of it disappearing or almost going away soon after surgery. I have yet, it's over a year.
I feel it was the best thing I ever did for myself. The best thing I could have done for myself health-wise, because my health is totally back to where I need. I have more energy now than I ever had before.
Every day I see myself in the mirrors, I laugh. Gosh, look at me. I don't have any of my clothes anymore. I actually officially gave away every one of my clothes that I used to wear.
I can't stress enough on the fact of my grandkids. Being able to play with them is just the ultimate.
I just thank God for the change. This surgery was like gave me new life. It really did.
Our doctors currently perform 3 types of bariatric surgeries. These surgeries are all clinically proven safe and effective in long-term weight loss. Each surgery has its own unique benefits, risks, and outcomes. So let's take a look at each one. Gastric banding, or the lap band.
The lap band is a restrictive device that acts like a belt. It goes around the upper portion of your stomach and allows you to eat less food and feel full.
After surgery, a lot of times for patients, when they eat small meals, they feel full for the first time. They've never really felt that full sensation. So eating fewer calories, they're able to lose weight, and they were never able to do that before because they were chronically hungry. The band itself is attached to some tubing, and that is attached to a port. And the port goes underneath the skin, under the fat, on the muscles of the abdominal wall. It allows us to put a special needle in that to adjust the band to make it either tighter or looser so that the patients get the right amount of what we call the restriction.
As you tighten it, you lose weight. You lose weight because you eat less calories, and you don't need to snack because when the lap band is adjusted appropriately, you feel full and can go between meals without feeling the need to snack.
After the lap band, the weight loss is slow. It tends to be about 1 or 2 pounds per week. So we usually tell people it's going to take them about 2 or 3 years to get down to their goal weight.
The average lap band patient by 3 years has lost 60 out of every 100 pounds that they're overweight.
All the operations have some risk, and as does surgery in general. With the lap band, although things can happen that require reoperation, it is exceedingly rare to have any problem that is a life-threatening sort of problem.
Now, the best part of having a lap band is its safety profile. It is simply the safest bariatric surgery there is.
We don't divide and reattach things. They don't really have the risk of a leak. You don't get malabsorption. You don't get dumping syndrome, which is something that can occur with the gastric bypass.
It's so much less invasive than all the other procedures. Most people go home from the hospital the same day they have the surgery, and most people are back to work within 2 or 3 days.
Lap band benefits. The lap band is the least invasive operation. It allows you to return to work quickly with shorter hospital stays. The lap band is adjustable and easily removed. It's also considered the safest bariatric procedure.
The biggest drawbacks for the lap band is the slower weight loss. It typically takes a person 3 to 5 years to lose their weight after the lap band, and the chance of slippage.
Well, some of the risks are things that can happen with any surgery. There are things like blood clots, pneumonias, infections of the wound. There are some things that are specific to lap bands. Probably the one that we hear about the most is a slip, and that's where if the band is on the top part of the stomach actually slips up above the band and blocks it off so that people aren't able to eat or drink. Another one that is heard about and occurs very infrequently is what's called an erosion, where the band actually erodes through the stomach wall into the inside of the stomach.
One of the most important things that a person has to do after they have a lap band is follow up with their physician. The average person needs to follow up in the office at least 6 to 8 times in the first year to be successful long term with the lap band.
Adjustments are a really critical part of the lap band functioning. We talk about green, yellow, and red zones, and the goal is to be in the green zone where you're feeling satisfied with small portions and losing 1 or 2 pounds per week. People are way more scared of having it done than after they've had it. They said, "Is that it?" But what happens, patients come in, we clean off the area where the port is, and then we put a special needle in there. Sometimes we'll numb the skin up first. And I would say it hurts less than having an IV put in, so it's really pretty minimal.
Lap band drawbacks: slower weight loss, frequent adjustment to achieve best results, risk of slippage and erosion. A 3-year study was performed involving 218 lap band patients with an average age of 44. The average starting BMI was 47.2. The average ending BMI was 31.
My name is Shelley. I had the lap band surgery, and I had it 6.5 years ago, and I'll be honest, if I had to do it again tomorrow, I wouldn't hesitate. It's one of the best things I ever did. It didn't save my life, it gave me my life back. There's something that happens to a woman's psyche when you can't lose weight and you think you can. You almost want to give up, and that's where I started realizing I was losing an emotional battle with my weight, and it was miserable. After researching the bypass, I knew I needed to do something, but it was too extreme for me. It works for many, many people, but I needed the help of my support person, so I chose to have the lap band surgery because it was something that was reversible, it was slower, it was less invasive. I still needed the same support person, I still needed to follow the same rules about exercise and nutrition, but it was something that was more tolerable to my lifestyle and to my support person. So that's why I chose the band. I've lost probably 85 pounds after the lap surgery, and I continue to tone up and look better all the time. And this is where I get teary about it because I know people's lives could be changed by having this surgery. It's not a cure-all, it's not a fix, and I'll fight anyone who says it's easy. It is not easy to lose weight. It's not easy to change your life, but it is so incredibly worth it. Sorry.
Another option in weight loss surgery is the sleeve gastrectomy.
The sleeve gastrectomy is an operation where we remove the stretchiest parts of the stomach. The stretchy parts of the stomach are the ones that allow you to eat big meals.
A sleeve is actually a pretty simple operation. What it involves is making a tube out of the stomach and getting rid of the part of the stomach that distends and can fill up with a lot of food.
So at Thanksgiving, when you sat down and ate 3 plates of food, the part of the stomach that stretches is the part of the stomach that we remove. So this is nothing but a surgery to reduce the volume of the stomach.
What you've done essentially is remove the part of the stomach that allows you to eat so much so that you get full eating less.
The great thing about the sleeve is that at the end of that tube there's a muscle called the pylorus. This muscle restricts the flow of food out of the stomach. The sleeve allows you to feel full by keeping your own stomach and your own muscle at the end of the stomach and still being able to eat the small amounts of food.
So the sleeve is different. Unlike the band, you don't rely on a device to be able to work, so it doesn't need to be adjusted after surgery. Unlike the bypass, you don't have to rearrange everything. Food goes down the normal way. The weight loss is faster than it is with the band. So it's kind of what you'd consider, I guess, an intermediate procedure between the two.
Some of the reasons people choose to have a sleeve gastrectomy are they really want to keep their anatomy as normal as possible. The fact that the gastric bypass moves intestines and stomach around bothers some people. And then the lap band, the fact that they have that lap band inside of them, that also bothers some people, which is why those people choose the sleeve gastrectomy.
The benefits are that you don't have the malabsorption like you do with the gastric bypass. The weight loss tends to be faster than the band, not quite as fast as the bypass. And patients don't get dumping syndrome like they do with the bypass.
Some of the benefits of the sleeve are it's shorter recovery time. Typically people only need about a week off from work.
I guess you would consider the sleeve the middle road because you do divide the stomach, so you do have a little higher risk in terms of having a leak from where you're dividing. But you have the benefit of it working a little bit faster than the band and not needing the adjustments like you do with the band.
The most common reason I suggest that people have the sleeve gastrectomy is if they're worried about long-term complications. The sleeve gastrectomy simply has fewer long-term complications than any other procedure that we currently offer for bariatric surgery.
The benefits of the sleeve gastrectomy are no adjustments, fast weight loss, no malabsorption, no dumping syndrome, shorter recovery times, and fewer long-term complications.
One of the drawbacks with the sleeve gastrectomy is that it's newer, and we simply don't have the long-term data that we have with the band and the bypass.
It's a newer procedure, so we don't have a long track record with it. We're starting to get 5-year data, and it looks pretty good, but again, we don't know 10 and 15 years out how do patients do.
Some of the drawbacks to the sleeve gastrectomy is not all the insurance companies cover it.
Insurance companies have been hesitant to cover the sleeve gastrectomy. That's starting to change, but it's hard to know how fast that will change.
Another complication of the sleeve gastrectomy is leaks. All stapling procedures, such as the gastric bypass and the sleeve gastrectomy, carry a chance for leaks.
There is a big long staple line, and potentially it could leak anywhere along that. People who have had leaks with those have found that they're difficult to manage. And that's something we haven't experienced yet.
The leak is like plumbing in your house. When it happens, it needs to be fixed immediately.
So some other drawbacks of the sleeve, it's not reversible. We've taken out part of the stomach and we can't put that back in. The sleeve was actually developed as a staged procedure. So patients would have the sleeve and then come back later after they'd lost 200 pounds to have the rest of a gastric bypass or a duodenal switch. So it does have options even though it's not reversible.
Drawbacks of the sleeve gastrectomy. As a newer procedure, it's lacking in long-term data. As a result, insurance companies are reluctant to cover it. This procedure is not reversible, and there is a potential for leaks.
I had gotten to the point where all the clothes that I owned I would buy online or through catalogs because I did not want to go to the store and have to try them on. My name is Debbie Millay, and I had the sleeve gastrectomy surgery. I've lost 118 pounds, and it has changed my life. I am a better mom and a better grandma and a better wife because I'm a new person. I had grown up always being thin, and it was when I started to have children that I started to gain weight. With each pregnancy, I would gain 40 pounds, and then after the baby was born, I would lose 20, but I would keep 20 on. So after 4 kids, that's 80 pounds, and then after that, it was just so fun. I decided to keep going. So I ended up weighing, when I had my surgery, I weighed 258 pounds. The reason I chose the sleeve is I liked the idea of you go and you have the gastrectomy and that's it. The weight came off for me very steadily. I never had any gains. It steadily came off, usually about 2 to 3 pounds a week. and I was very happy to see it go. I know it seems like it should take forever to lose 118 pounds. You know, it was less than a year. Within 9 months, I was very happy. My daughters were all really happy until I started to get down at around the weights that they were at, and then it was like, you're our mom, you can't be skinnier than us, you know. One of the biggest motivations was having my granddaughter and knowing that I wanted to be around for a long time to see her grow up and to have more grandchildren, which hopefully is going to happen one day.
Another option in weight loss surgery is gastric bypass.
We would really consider the gastric bypass the gold standard of weight loss surgery. It's been done since 1967. We've been following patients for long term. We know that there aren't terrible long-term ramifications. Patients can sustain that weight loss for a long period of time. There are kind of two components to the gastric bypass. The first is that we make a small gastric pouch, and it's about as big around as your thumb. Then we bypass the top part of the GI tract, divide the bowel downstream, and bring it up to that little stomach pouch. So food goes through the esophagus into the little pouch and then directly into the small bowel, bypassing the top part of the GI tract.
The gastric bypass is made up of two components, restriction and malabsorption. The restriction of the gastric bypass happens when we create a new small stomach from the larger stomach. The malabsorption of the gastric bypass occurs when we bypass the small intestine to a certain extent and not all the fat that people eat gets taken up into their bloodstream, thereby going right through their body and decreasing their caloric intake. Some of the best things about the gastric bypass is its quicker weight loss. The average patient loses their weight between 9 and 18 months. It's also paid for by most insurance companies, so if your insurance company has the benefit of bariatric surgery, they usually will cover the gastric bypass. And one of the other benefits of gastric bypass surgery is its great long-term weight loss. We have results out 15 and 20 years showing that people, once they lose weight with the gastric bypass, truly can keep it off long-term.
So some of the benefits of the gastric bypass are that the weight loss tends to be the fastest, and also people tend to lose more weight than with the other procedures.
The bypass is a great operation for people who need to lose weight quickly. It's also a great operation for people who are diabetic or hypertensive or have a history of strokes because it's so effective in reducing patients' cholesterol and insulin and glucose levels.
It's really important to realize that this operation has been around for a long time. It's been done very safely for a long time. And there are a lot of things that have changed in the last 10 years that have made this an operation that's even safer than having your gallbladder out.
One of the good and bad points of the gastric bypass surgery is the dumping syndrome. Dumping syndrome is when you get nauseated and stomach cramps and you feel sweaty because you've eaten something sweet or high in carbohydrates. This is good for most patients who have the dumping syndrome because they're not tempted to eat the sweets or the high carbohydrates.
The benefits of the gastric bypass include quicker weight loss, greater weight loss, dumping syndrome. It's been extensively researched and is covered by most insurances.
When we look at drawbacks of the gastric bypass, we're really looking at two different things, the short-term things and the long-term things. So short-term, although they're very infrequent, they can be life-threatening sorts of problems. Things like leaks, abscesses, bleeding, and those are things that can be life-threatening. Long-term, some of the drawbacks of it, you can get malnutrition, where you actually need to get some kind of supplementation for vitamin and mineral deficiencies.
The biggest drawbacks with the gastric bypass are its long recovery. Typically people take around 2 weeks to get better from having a gastric bypass.
We usually keep patients in the hospital just overnight. In general, they go home the day after surgery. But they probably plan on taking 2, 3, sometimes even 4 weeks off of work before they're really feeling like they're functioning at their full potential.
The second drawback for the gastric bypass is its difficulty to reverse.
We're actually going in and rearranging your anatomy. It technically could be reversed. We could go back and hook things up, but the reality is that we'll never work the same way that it did before surgery. So this is a long-term permanent fix. You would anticipate that that's always going to be what your anatomy is going to look like. One thing that's important to realize, if you've chosen the gastric bypass, you need to be committed to a lifetime of follow-up. You can develop vitamin, mineral, nutritional deficiencies that may not show up for 5 or 10 years. So checking regular labs, following up with your physician are an important part of catching those things early, getting on top of them so it doesn't develop into a big problem.
The drawbacks of the gastric bypass include a longer recovery time. This procedure is not reversible. There is a risk of malnutrition. Complications are fewer but tend to be more severe, and dumping syndrome. In a 3-year study of 218 gastric bypass patients who started with an average BMI of 50 had an average ending BMI of 26.
My name's Leanne Jensen. My surgery was September 13th, 2005. I wished I had have done this 25 years ago.
My name is Letitia Grimmett, and this is my husband, Derek, and I've had the gastric bypass surgery.
I was over double of what I weigh right now.
On July 14th of 2008, I had the gastric bypass surgery, and now I've lost 180 pounds. I haven't been this small since I was 10 years old.
Before the surgery, life was miserable. Didn't do anything but sit on my butt, didn't go anywhere. I would go to the kids' baseball games or football games, always sat and watched them. Never ever was able to get out and play ball with my kids or sit on the floor and play cars and trucks with them. Just very inactive life.
At the end of high school, I weighed 350 pounds, I believe.
Finally, the scale kept getting big, larger and larger, and I think the light bulb came on when I went to Walmart and I tried on a 3X, and it was too tight, and they only had one more size to go, and that was a reality check.
My dad died when I was 12, and I refused to let my kids lose their dad early.
I hated watching Gold's Gym commercials and Bally Gym commercials. I hated watching the fit people. I was like, turn, that will never be me.
Didn't go to concerts, didn't go to movies because I couldn't fit in the seats at theaters. Just didn't do anything. Went to work and went home, and that was about the extent of it.
They say do 20 to 30 minutes. I couldn't do 15. Even after the surgery, I was doing 10 and 15. I was exhausted. So it was like, I can't exercise the way you want me to because I'm too tired. My body hurts, my back hurts.
I'm very empathetic towards overweight people because I try to have conversations with people. I almost go out of my way to have a conversation with someone who I can tell is overweight and struggling with it, and let them know that I know where you're at. This is an option. If you have any opportunity to do this, you should look into it.
I have to track her down to find out where she's working
I'm at the
out.
gym no matter what, and I'm mad at any occasion that stops me from going. Like now they invite me out. This weekend it should be exciting. We're invited to cookouts. I'm like, I just want you to know that you're interfering with my gym time.
I've told many people I'm living. For 50 years of my life I didn't live, and I'm living now.
I run around, I chase my kids all over. I jump like I'm a crazy wild animal and make all sorts of funny gestures, and it's a blast.
I get out, I play ball with the kids. I've been on the trampoline with the kids. I've tried roller skating with the kids. I've been on rides at amusement parks. I've done motorcycle rides. You name it, I've about tried it now.
Everybody's starting to get a little bit more fit because now my kids like to go and work out with her.
Yeah, they see me working out, and I take them with me when I pick them up from work.
And I wished I had had this surgery many years ago because I would have liked to live longer than, the next 110 years.
But to just tell somebody who's thinking about it, don't think, go through with it. Search out every option you can find to do it because it is so worth it. I call it an investment because I invested in my own life. It is the best investment that you can ever make.
Definitely worth it.
Yeah, the surgery is definitely worth it.
I wake up every day, and on my ride to work, honest to God knows, I say every day, thank you. This was so worth it. It was so worth it. Every day I'm grateful that, you know, I wouldn't have it any other way. I would have never made any other decision. This is like one of the best, well, one decisions I made personally in my life.
Our doctors consistently outperform national averages for both weight loss results and complications. We believe the factors for patient success involve commitment from 4 parties: patient commitment, family commitment, hospital commitment, and physician commitment.
Part of the approach to weight loss is a team approach, and that's what we do at the Surgical Weight Loss Center of Utah. Without each of those functioning together as a team, the weight loss results for you will be suboptimal.
The first factor in patient success is the patient commitment.
When a patient decides to have bariatric surgery, they need to make certain commitments in their own life, and these are the most important factors in determining success.
One of the commitment we expect nutrition-wise is that patients eat 3 small meals a day, consuming about 4 to 6 ounces per meal. We ask patients not to drink with meals. Liquids tend to empty from the stomach really quickly, and so if you mix solid food with liquids, it makes the solid food empty more quickly, so you need to eat more.
And there is supposed to be no snacking. I tell all my patients there is no such thing as a healthy snack.
And then avoiding things like big glasses of mocha frappuccino or orange juice that can have a day's worth of calories in one glass, but really don't make you feel full. After surgery, we want patients to be able to eat to live rather than live to eat.
The nutrition commitment involves 3 4 to 6 ounce meals a day. Avoid snacking. Avoid high-calorie liquids, and do not drink liquids with meals.
Patients really have to be committed to changing what they've learned all of their life up until that point. It's a sea change, and it's really important to start making those changes even before surgery.
The next thing we ask our patients to do is exercise. Now, many people have been lied to throughout their life and have been told that exercise leads to weight loss. But the truth is, exercise only leads to weight maintenance. In other words, the diet that we tell you to follow will allow you to lose the weight. The exercise that you perform will allow you to maintain that weight.
Going to support group is really important. You know that patients who go to those tend to do better.
Take your vitamins. Many of these surgeries result in rapid weight loss. Oftentimes, the nutrition is suboptimal.
Taking multivitamins is important. You're not eating a lot, so you want to make sure that you're getting the nutrients that you need to be healthy.
Follow up with your physician, and that's because when you follow up with us, we know the problems that you experience and we can help you get through them. The most important part about surgery is the commitment the patient makes to change. None of these surgeries are a magic bullet. None of these surgeries are easy to maintain weight loss with. However, all my patients tell me that if they make the commitment to change, that the weight loss is possible with the aid of this surgery that they could never have done on their own.
The wellness commitment includes exercise at least 30 minutes a day, 5 to 6 days a week, attend support groups, follow up with your physician, and remember to take a multivitamin. The second factor in patient success is the family commitment.
There are 3 things that families need to commit to do to allow patients to be successful. The first one is committing to changing the environment in the home so they're not tempted to snack.
They need to focus their activities less around food, try and work on other sorts of activities, just celebrating time being together with family and friends as opposed to centering the activity around food.
When patients don't have strong family support, they end up snacking or they end up drinking their calories. And when that happens, they fail long term. Most of the surgeries will allow you to lose weight in the short term, but long-term commitment to weight loss has to be made by the family as well as the patient.
And when patients' enthusiasm or willpower is flagging, patients or families can really contribute and kind of boost them back up, keep them going, keep them motivated.
The second one is to allow them time to exercise, and the third is to allow them time to go to support groups.
The support groups are a combination of things. We try to provide some sort of follow-up education, whether it be about diet, exercise, whatever else. But it also is a time for patients to get together and share their experiences. A lot of times people have been struggling with different issues, or they're experiencing something, they're not sure if that's normal, they're not really sure how to deal with it. And hearing and learning from other patients can be as valuable as anything else.
The family commitment involves having a new outlook, including purchasing foods that support the patient's new lifestyle, allow the patient time to exercise, and encourage the patient to attend support groups. The third factor in patient success is the hospital commitment.
We really evolved as a complete multidisciplinary program. We wanted to do that from the outset. We wanted to provide the education necessary, but also the support so that after surgery patients could be successful.
The hospital has made a commitment to have exercise specialists on staff and dietitian specialists on staff. In addition, we have specially trained nurses in both the floor and the operating room.
We have specially trained personnel who are equipped to deal with the special needs of the overweight population.
A hospital that doesn't do all this will have suboptimal outcomes, and as we partnered with the hospital, we've achieved great success.
When I started the Surgical Weight Loss Center, the hospital was a big component of the whole program, and we've worked from the ground level to get things up and running. Part of that is that we are now what's called a Center of Excellence.
A Bariatric Surgery Center of Excellence is a designation given by the Surgical Review Corporation of America. It signifies that the surgeon and the hospital have teamed together to achieve very good results in terms of weight loss and low complication rates.
So the Center of Excellence really evolved as a means of addressing quality issues and making sure that patients did well, that the surgery was done well, the complication rates were low, and the success was good.
Hospital commitment. We offer the only complete multidisciplinary team in the Intermountain West, and we've been designated a Bariatric Center of Excellence. The final factor in patient success is the physician commitment.
We've been consistently able to beat national averages in both weight loss and low complication rates because we specialize in only bariatric surgery, and that allows us to focus all our energies and attention on being the best at what we do.
Because Dr. Kahneman and I are committed to doing pretty much all weight loss surgery, we can really make sure that our patients are getting the benefit of all of our efforts as well as those of the rest of our team.
This means that we are on the forefront of all the trends and newest innovations in bariatric surgery.
We have been involved in various kinds of clinical research. We continue to educate other physicians who are bariatric surgeons and helping them learn new techniques. We also are involved in some basic science research and trying to kind of understand the genetics of obesity and weight loss. We're kind of a package deal. So if Dr. Kahneman is your doctor, I'll be your assist, and if I'm your doctor, Dr. Kahneman will be my assist, and so you really get the benefit of having two surgeons operating on you.
One of the reasons why Dr. Richards and I have been so successful is that we do almost all our cases together. This allows familiarity between us. So literally, she knows exactly what I'm going to do at every step of the procedure, and I know what she's going to do at every step of the procedure. And if you ever would watch us on film, you would never know who's operating because we do the procedures so much alike.
We know in laparoscopy, having an extra set of eyes can be really important, kind of a check mechanism to make sure that you're seeing what you're seeing and doing what you want to be doing.
We're the best choice for weight loss surgery because we specialize in only bariatric surgery. We have a complete multidisciplinary team, and the hospital has made the commitment in order to achieve optimal success.
Physician commitment. Our physicians work exclusively in the field of bariatrics and are dedicated to research. Our physicians focus on improved surgical outcomes and long-term successes, and there are typically 2 bariatric surgeons with each surgery. Thank you for watching this weight loss seminar. This is the first step on your path to weight loss. Thank you for your time and good luck on your weight loss journey.